All right, Miss Emily. Thank you
Hello.
for joining me today.
Yeah.
First, I want to be clear and let everyone know that you are giving your full consent for us to share this video so other moms understand how incredibly powerful physical therapy can be during pregnancy. Is that
Yes,
correct?
I am. Absolutely.
Okay, so you're okay with this being on social media, the Google reviews, all that good stuff.
Yeah, that's totally fine.
Awesome. Thank you. I really appreciate that.
Of course.
So if you could share a little bit about your story, how we worked together for your second pregnancy, and why you reached out for your third.
Yes. For my second pregnancy, I had a lot of SI joint pain, like in that lower back area. So we worked together on that, gave a lot of home exercises and the way to do the pelvic correction and everything. So that was really helpful for that pregnancy. Was able to keep up with those exercises, and really after that, the rest of the pregnancy went a lot smoother. So that was very nice. For the third pregnancy this time around, we gave reached out for that with just getting a little bit of that pain back. Now, honestly, with having worked with you before, I had a little bit of more knowledge this time around.
Love it.
So I didn't notice it as soon in my pregnancy, like I'm 27 weeks now. But now, I take my boys on walks a lot of times a day.
Every day,
all being
4 times a day.
Yes, with us all being home, 1,000 walks a day, yes.
Yep.
And after, say maybe 10, 15 minutes of walking, I start to feel a little bit of that SI joint pain coming back a little bit. It's not as bad as it was before, but it's definitely still there. I think just as I'm getting a little bigger, I'm feeling it more.
Yeah, okay, absolutely. And so is it both sides of your low back or just one?
I feel it more on the right side. It can kind of go back and forth, but mostly on the right.
Mostly on the right. Okay. And is it isolated like it used to be, just one pinpoint spot, or does it go down your legs into your buttocks?
No, I don't notice it radiating. It just stays in that spot.
In that one spot. Okay. And only after you start walking for about 10 minutes?
Yes. The first few minutes is fine. But as I get a little further in the walk, like 10 minutes or so, I'll start feeling it more.
Okay. And then how do you feel like your walking form has been? Because I know we worked on that last pregnancy and you were really aware of when you're walking properly versus when you start to waddle. So any thoughts on that or updates on that?
Yeah, my walking form has been okay. I've tried to still keep conscious of walking, being conscientious of my posture and holding my abdominals tight and everything with that. I do still catch myself waddling sometimes, I must admit. If it's a long day and it's the end of the day and I'm just getting tired, my body I can feel it start to get lazy and I have to go, oh, hang on.
Bring it in. Okay.
Yeah.
All right. So you notice it, but it's not all day. Like you don't think you're waddling during the day.
No, not all day, but I definitely notice it towards the end of the day. Yeah.
Okay. Love it. All right. So let's see what we can add, Emily, to your current program. I'm going to have you do a few quick screening motions to just see if there's anything new, but I kind of have ideas of what we can supplement for you to get you past that hump, because you're in your third trimester practically.
Yeah.
So it's all downhill after this. So we want to really capture that stability as much as possible, see if there's any tightnesses, asymmetries that have kind of crept up, and then we'll go from there. Sound good?
Yeah, I love it.
Okay, so first what I want to see, if you can turn to your right for me.
Okay.
Look at that belly. Does it stay if you let go? There we go. Okay, can you, in that position, can you bend forward as if you're going to touch your toes and only go as far as you're comfortable going?
Okay, yeah. That's about it.
Okay, and come on back up.
Okay.
Okay, and now, did your hamstrings feel tight there?
Yes.
Okay, all right. And now, only as far as you're comfortable going, I'm going to have you do a back bend. So you're going to look to the ceiling and lean backwards.
Okay.
And I'm just going to watch your spine. Look at you go. Okay. And come back up.
Okay.
All right, so a little bit of like a hinge movement at your lumbopelvic junction there. Okay, and now can I see your back? So can you face away from me?
Yeah, sure.
All right, so hands by your side.
Oh, by my side, okay.
Yeah, that's good. Okay, so I do see that asymmetry coming back a little bit. Can you connect with your feet right now and just feel, does one of your legs have more weight in it than the other? Or is one pushing down into the floor more?
I'm actually feeling a little more weight on my left leg.
Okay, interesting. All right, so now in this position, can you do a side bend for me? So you're gonna take that right arm and slide it down your right leg as if you're gonna touch the outside of your right foot. Beautiful, good, good. And back up. Okay, and now can you do it to the left? Okay, yep, and back up. Okay, go ahead and bring your arms across your chest for me.
Okay.
And look over your right shoulder. Keep your hips pointing straight and just twist a little bit through your back. Let me see if you've got, yeah, there we go, good.
Okay.
Okay, and then the other way, look over your left shoulder and keep twisting. Okay, and look center again. So any symptoms with that? Anything irritate?
Not right now, no.
No, okay. Now, go ahead and put your hands on your hips again for me. Okay, and now, can you find those hip bones? Remember I used to feel on the shelf of your hip bones?
Yeah.
Yeah, there you go. Okay, and now, can you stand on just your right leg? So bring your left knee up towards your chest.
Yes.
Yeah, good. And back down.
Okay.
Okay, and can you bring your right knee up?
Yes.
Okay, not bad. All right, and bring it back down. No pain with those?
No pain with those, no.
No. Okay, all right. Are you able to lay on your bed and I can see you from the side?
Yes.
Okay.
Actually, it's probably easier if I lay on my floor. Is that okay?
Sure, yeah. Is that okay with you?
Yeah, it's fine. It's
Okay.
carpet, it's comfy.
All right. And if you need to be elevated, you can certainly put pillows or a wedge. If you still lay flat on the floor to play with your boys, we won't be more than a moment or two.
Okay.
Maybe 3 or 4 minutes.
Yeah, I'm on the floor a lot with the kiddos, so hopefully it won't be a big issue there.
They're how old again?
3.5 and 16 months.
Oh my goodness.
So we'll have 19 months between this one and the baby.
Wow. That is incredible. Okay, that's perfect. Okay, so now rest your shoulders down a little bit lower. They look like they're high up by your ears. There you go. Good, good, good. And now if you hug one knee towards your chest and bring that foot across, do you feel any tightness? Yeah, so knee up and then pull that foot towards your opposite shoulder. Okay.
Oh, so pull the foot like I'm stretching.
Yeah, there you go. Okay.
Yeah, I do feel a stretch with that.
Yeah. Okay, so hold it there for a moment. Breathe into it. Any symptoms in your SI joint?
No, not right now.
Good, good. Okay. And now if you let that right foot rest on your left thigh,
okay,
and you push that right knee away from you. Any pain with that?
No.
Okay.
All right.
Does it feel like a little bit of a stretch?
Yeah, it does.
Yep. Very good. Okay, so hold it down there. Nice, easy breaths. How has your breathing been? Do you get short of breath at all?
Occasionally, actually, yeah.
Okay. Okay. And now go ahead and switch, other leg.
Okay. I'm pulling it in first.
Yeah, so go ahead and give it a hug towards your chest. Bring that knee and foot towards you. Awesome.
Definitely getting a stretch.
Yeah. So these are the go-tos for that SI joint pain. And there's a few other exercises, yeah, that I wanted to add as well, based on what you're telling me. And so it sounds pretty good, though. If you're able to walk for a good 10, 15 minutes before the pain starts, you're keeping the stabilization that you have through the exercises. We just need to beef up your program a little more and see if that helps. Okay. If it doesn't, then you might need some manual work once our at-home orders are lifted. And it's a little bit of sacral work, a little bit of the pelvic rotation, and that usually does the trick, okay? But in the meantime, we're going to have you try one more self-mobilization plus some of these stretches.
Okay. Awesome.
So pushing that there, yep. All right, so go ahead and uncross your left leg.
Okay.
And before we do the pelvic self-mobilization, I want you to try that breathing. Now, I know you're far along, you already lay on your back flat like this, but ideally you're gonna have your head up, right?
Mm-hmm.
And what I want you to do is gently place your hands on the lower part of your ribs, yep, right where that belly starts. And when you breathe in, I want you to imagine that you're gently bringing your hands apart. So you feel those ribs opening, yep, to the sides. And then as you exhale, give them an extra little hug. Okay, a gentle squeeze there for me, yep. And then you're gonna breathe in, feel them expand. And as you exhale, gently push them closer together. Continue like that. And what I want you to imagine while you're doing that, Emily, you want to make sure there's not too much movement or energy going up towards your head as you breathe in. Even though your belly is pretty full of baby, you want to allow that tummy to kind of soften and accept some of that space that the air is taking up. Okay? So you want to allow that air to travel downward versus coming up here. The other thing is that you want to get motion through your whole rib cage. So you want to feel your back kind of push into the floor a little bit. You want to feel the front of your rib cage lift. So it's what we call 360 or like an umbrella breath. The whole rib cage opens up and it shares that movement, okay? Because we can kind of feel stuck with inhalation, especially in the third trimester.
Yeah.
Okay. Breathe in. Good. Can you connect with and kind of feel that movement coming from all aspects of your rib cage?
Yeah, definitely.
Awesome.
The first few breaths, I was like consciously keeping my shoulders down.
Yep. Makes a big difference, right?
Yeah, yeah.
And now what I want you to do as you exhale, gently draw that belly in like we used to work on, where you either bring those hip bones closer together, or you can imagine zipping up a pair of tight pants as you exhale.
Okay.
Nice. Okay, so when you breathe in, you're going to allow everything to soften and expand. And when you exhale, you're going to really engage those deeper core muscles like we talked about. Okay?
Okay.
And now, do you have your ball nearby?
Yes, I do.
Okay. So roll to the side. That a girl. Taught well, huh?
Yes, yes.
Awesome. Love it.
I have to admit, I stole this from my child's room.
Yeah, he deserves it. That's okay. All right, so now you're going to place that ball between your knees, okay?
You need to see my knees?
No, it's okay. It's okay.
Okay.
What I would say, though, is you want to make sure your knees are at the same height, okay? So you don't want one foot too far in front of the other. When you look over at your knees, you want them to look pretty equal.
Okay. That's good to know.
So on your next breath, as you exhale and tighten that tummy, you want to gently squeeze that ball between your knees.
Okay, okay. We're going to do...
Awesome. And any pain with that?
No, not today.
Love it. Okay, one more like that. Exhale, draw the tummy tight, gently squeeze that ball. Good. And now on the next one, you're going to do the exact same thing, but you're going to tighten your buttocks as well and lift your bottom up off the floor. Okay, can you do that for me?
Yeah, okay.
All right. Stay connected to how your head feels too. If you feel lightheaded, dizzy, anything like that, we might need to get you up out of that position.
Okay.
Good. And then slowly back down. Beautiful. Okay, let's do a few more like that. Do you feel the little shaky shake on the way down?
A little bit, yeah.
Yeah. Okay, so that's a little bit of pelvic instability, but also, Emily, honestly, the way your pelvis is expanding right now and your muscles attached to those pelvic bones and they're kind of like holding on for dear life as it spreads. And it has a heavier load because that baby's growing. So those components all summing up typically create a perfect environment for some joints to not function as perfectly as they might. So if you're able to walk without pain, so it's not every single step, it's with endurance, then that to me says that there's musculature that is failing you once it gets tired. Does that make sense? Okay, so this combined with a few other exercises are really going to get you past that hump. But right now I would respect that time frame. So if you're walking and then you start to notice pain or like that you're limping a little bit, let that be your threshold and kind of respect it. And then watch as you do these next few exercises that we go over together. I want you to watch that threshold increase. Does that make sense?
Yeah. Like as I do the exercises, I should be able to walk a little bit further before I feel the symptoms.
Yes. Yeah. That would be our goal. And for sure, we want to watch out for any like decreased endurance, right? So you definitely don't want to be like, oh, now I can only walk 5 minutes, because then we need to reassess and say, okay, what else could be going on? It could be coming from your rib cage. It could be coming from the spine, but wasn't too much significant in there that I saw from your exam. So this is where I'm thinking you're at. Okay?
Okay, awesome.
All right, so let's do a few more bridges.
Okay, so still the breathing in and the bridge?
Yep.
Okay, perfect.
Good, nice breath in. I saw a kick. Exhale and squeeze. Tighten that bum. Good. And then slowly back down. Awesome. And I know your spine is a little bit locked up with belly in the front, but if you can imagine that you're lifting up one backbone at a time and then lowering one backbone at a time. You won't actually do that, but you want to think it, and that will help you get a little more segmental mobility with that bridge. Okay, so let's try that there. Deep breath in. Good. Exhale, draw that tummy tight, ribs come down, tighten the buttocks, and one backbone at a time. Good. And then slowly back down. Beautiful. I love it.